My name is Frank Guyette. I'm an emergency physician and an EMS physician, which means a physician that works outside the hospital, usually in EMS vehicles like an ambulance or a helicopter.
Hi, my name is Jason Sperry. I'm one of the principal investigators of the up-and-coming trial that's going to be performed in the pre-hospital setting. It's called TOWAR, and that stands for Type O Whole Blood Assessment of Age Pre-Hospital Resuscitation Trial. And what we're doing is comparing administering and transfusing patients that are severely injured and bleeding whole blood, which is blood that has all the components, as compared to specific components of blood, for example, red cells. This is a multi-center study. It's going to be done across 10 centers across the United States, and the University of Pittsburgh is organizing the study and will also be participating. This study is done in an emergency situation, and the patients are brought either by ground or air transport to Level 1 Trauma Center. And there's no time to consent these patients for participation, as they're in a life-threatening critical situation. And it's being done under exception from emergency consent, which is approved by the FDA and our local IRB.
EFIC studies are rare. Most cases, whenever we do any type of research, we need to get a patient's permission before we do a study on them. What's unique about EFIC studies are that they have to meet certain requirements, and one of the key requirements is that the patient is at risk of a life-threatening injury. In this case, patients who are bleeding to death outside the hospital are most certainly at risk of a life-threatening injury, and the window or the opportunity to treat them is very, very short. The blood products have to be administered very quickly at the scene of injury, and there's usually not time to seek the patient's consent or the consent of a loved one or relative.
Previously shown that if we give plasma in the pre-hospital environment, it's associated with a survival benefit. So we believe if we were giving all the components of blood, and we believe giving this early in the pre-hospital phase of care may be important.
As we were talking about administering blood products, one of the concerns that we have when doing any type of study is that all interventions, all treatments come with some kind of risk. And the risk from blood products is primarily from transfusion reactions. And usually the consequences are pretty minor. Things like fever, perhaps a minor rash, and our flight crews, paramedics, nurses, physicians are well capable of taking care of those.
After arrival to definitive care at a Level 1 Trauma Center, patients and families can decide whether they want to continue participating in the study, and they will be offered the ability to opt out for continual participation.